All right, and without further ado, Dr. Watson.
Thank you so much, everyone, for having me here today. It's a pleasure to be here to share my research with you. And I hope you find this, worthwhile use of your time the first week back. So as Eliani said, my dissertation is about social worker perceptions of trauma-informed schools. It's a three-study mixed method analysis, and I will get started talking about that. So first, a little bit of background. I mean, we've been adapting trauma-informed approaches from more therapeutic settings to broader organizational approaches for the last couple of decades. And, it's gone in the last few years from one state education authority or like a handful of them to now over 30 have specific requirements to include trauma-informed approaches in their schools. Um, so we have this rapidly expanding movement, but we don't really know much about what trauma-informed schools look like in practice, nor do we know what they do once they're in place from an empirical perspective. I mean, we have some anecdotal evidence, but little other. What we do know is the reason for this is because trauma is pervasive. More than two-thirds of youth report having a traumatic experience before the age of 18. So this does seem like something that we should be thinking about in the education system. So what we do know, as I said, is trauma is pervasive and it does impact learning, behavior, and interpersonal relationships. Schools can be sites of healing or re-traumatization, and we know that trauma-informed approaches work on like an interpersonal clinical level. So we have plenty of support that things like TFCBT and CPIT work when you're doing them one-on-one. But are they scalable? Can we make an entire environment trauma-informed? That's kind of the question that remains. So what's missing is we have no consensus definition of whole school approaches. There's a lot of different ideas and frameworks for what that would look like. As I said before, there's limited empirical research. There's been some on how training impacts people's behaviors and responses, but not how an entire school system uh, redesigning so that it can more effectively serve people who've experienced trauma. We don't know empirically what that does. And there's minimal attention to equity. Usually, these approaches are treated as if they're colorblind. So we're not really adhering to some of the key principles of trauma-informed approaches from the very earliest conceptualizations. So this work began with a review of what was out there in terms of frameworks. Um, I developed a critical analysis, a critical review of a bunch of frameworks that were out and published models. That includes things like Harris and Fallett's original model. It includes SAMHSA's model. It includes specific school-based models like Cole and Wolpow. Um, and so what I did is kind of synthesize those into their common elements. And what I found was four core principles for what a trauma-informed approach looked like in practice. And that is understanding trauma and making a universal commitment to address it, creating an environment where everyone feels physical, emotional, and psychological safety, not just the kids, but the adults and the parents and other members of the community as well. Taking a strengths-based whole person approach, which is from Harrison Fallett's original work, and yet somehow over time we've kind of lost that in a lot of the frameworks. And then trust-based collaborative and empowering relationships. Now, I also added an explicit integration of anti-racism, diversity, equity, and inclusion to the work. And there is empirical support for that from my dissertation, so we'll get there in a few minutes. This model, which was published in Review of Education, uh, looks at multiple ecological levels from the individual and interpersonal all the way up to the organizational and community. So as I said, this was a mixed method, multi-study, multi-year uh, dissertation proposal or dissertation project. And the key question overarching is, what do trauma-informed schools look like from the perspective of school social workers? The three studies looked at different components of that. The first study looked at policies and practices and how those differed between trauma-informed and non-trauma-informed schools. The second study looked at perceptions in climate differences. And then the third looked at an in-depth analysis of what social workers said were essential to a trauma-informed approach and what outcomes they expected to see in trauma-informed schools. So the first study, as I said, was policies and practices. This was a quantitative approach with a national sample. There were 538 school social workers who took this online anonymous Qualtrics survey. They were based in 43 states in the District of Columbia. They were recruited through professional associations like the National Association of Social Workers and the School Social Worker Association of America. And they come from diverse school contexts. So we have K through 12 social workers represented. We have urban, rural, and suburban social workers. And we have social workers across a fairly wide spectrum of socioeconomic statuses. Um, and that was captured by the percentage of students that were eligible for free and reduced lunch in each school. So the analysis took a couple of steps. The first was doing chi-square test to assess whether the 33 policies and practices I was studying were more common in a trauma-informed school or a non-trauma-informed school. And then I did hierarchical logistic regression, controlling for school characteristics and personal demographics in order to see if beyond those controls were certain policies and practices more likely in trauma-informed schools. So the outcome variable for this and study two was a single dichotomous question that asked, is your school considered a trauma-informed setting? Now, the purpose of that is because I didn't want social workers to tell me whether they thought their school was trauma informed or not, because that kind of skews the results. So I wanted to know if their leadership was saying that the school was trauma informed or not. And of course, we don't have certifications or anything that say whether or not a school is a trauma informed school. So we couldn't use some kind of measure like that. So the initial findings were that schools that the social workers said were identified as trauma informed were significantly more likely to have 23 out of the 33 surveyed policies and practices. In reality, every single policy and practice was more common in a trauma informed school. However, only those 24 rose to statistical significance. The strongest predictors were trauma training for staff, resources for secondary traumatic stress, trauma psychoeducation for students and parents, and classroom practices that de-escalate and refocus students. Now, those all make sense. However, there was also metal detectors. So we begin at that point to start wondering what exactly is going on. Is this a resource allocation issue? Is this just random, or is there something more going on here? Now, I'm only sharing one spreadsheet with you today. I have a whole bunch more at the end of this presentation for folks who want to get into the details, but I'll show you this just as a baseline so you can see what I'm talking about. This is the initial chi-squares for policies and practices. And as you can see, trauma training is present in 80% of schools that are identified as trauma informed, and only about a third of schools that are identified as not trauma informed. You can see that classroom practices to de-escalate are present in 61% of trauma informed schools, and only about half of that in non-trauma informed schools. Trauma interventions and treatments, about 30% in trauma-informed schools, 13% in non-trauma informed. And you can see here that while not prevalent, metal detectors are 3 times more common in trauma-informed schools at 16.9% versus 5.3%. So then we move on to the regression findings. I tried an exploratory factor analysis to see if I could simplify the regression models. I was not able to because none of the factor structures encompassed all of the policies and meaningfully simplified anything. So what I did instead was a series of logistic regressions. The first one I entered in all typical school policies, things like social emotional learning, classroom practices that de-escalate, and saw which ones of those came up as significant in the first round. Then I did a second analysis of the COVID related policies. Some of those obviously we don't have anymore, like mask mandates, but we were seeing at the time things like expanded learning hours and support for students and families' basic needs. So I did a regression with those to see if any of those came up. And then I did the hierarchical logistic regression based on the policies and practices that were significant or close to significant in the initial rounds, and then adding in the school and personal characteristics in step one, and then those significant policies. So what remains at that point is trauma training for staff was 20 times more likely in trauma-informed schools, which makes sense, and resources for secondary traumatic stress were 5 times more likely. At this point, when you hold everything else constant, the metal detectors, which had been in there, fell out. So again, we'll talk a little bit more about what happens there. Some other things that come up in the initial analyses are that students with higher percentages or schools with higher percentages of students eligible for free reduced lunch or from historically marginalized populations were more likely to be identified as trauma informed. So there's multiple possible explanations for this. One, a positive one is maybe we're intentionally targeting trauma-informed approaches to schools that have higher trauma exposure. The second possible interpretation is that trauma-informed approaches are being used as a substitute for genuine transformation and adequate resources. So study 2 was developed to examine differences between social worker perceptions of climate in these schools to determine if there's more here that we can apply to this critical equity question. So going into study 2, the first study was about looking at what was on paper, and now we're looking at what does this school actually feel like. And to do that, I developed a new measurement tool. It's based on the critical review that I talked about earlier. And it has 4 culture and climate indices. Culture is the trauma commitment and training. It asks questions like, does this school provide regular trauma training? Do I feel comfortable and competent assessing my own and others' trauma behaviors? Things like that. Then the 3 climate indices with psychological and physical safety, strengths-based equitable focus, and trust-based relationships. Now, this instrument was developed starting with that critical review. Then I ran the questions by some experts from various places, but one of the places was the National Center for Child Traumatic Stress, where I had been an MSW intern. And then I did some cognitive interviews to see if the questions made sense to people. And now this is kind of the pilot test, and we're continuing to refine this instrument and its partner instruments, which can be used for other organizations. So this was the same sample, also a hierarchical logistic regression, again, controlling for respondent and school characteristics. As I said, validation is in progress, and it is showing strong internal reliability. So what we found in Study two is clear climate differences, holding everything else consistent. Um, Schools that were identified as trauma informed were almost 4 times as likely to feel safe to the social workers reporting on them. And they were more than 4 times as likely to feature strengths based and equitable focus and trust based, collaborative, and empowering relationships. So that's good. I mean, that tells us that, this commitment to trauma informed is actually making a substantive difference in the feel, the environment, the climate of the school. Of course, again, trauma awareness and training is the biggest identifier, which is 25 times more likely to have that if a commitment to trauma, basically, if you're identified as a trauma informed school. Um, but I think it's important that we remember that the other pieces of climate are still changing. Again, here though, we've got continued equity concerns. Now, we would always expect people of different races, ethnicities, other backgrounds, our personal identities affect how we perceive climate for sure. So it is not surprising that Black social workers reported a less positive climate experience across several of the indicators, even controlling for school characteristics, because different people experience climate differently, and maybe these schools are not as equitable climate-wise as we would hope. But there's another concerning piece. Also, by student demographics, schools with higher percentages of low income or historically marginalized students were less perceived as safe or having positive, trusting relationships. So that goes back to study one, where we saw that students or schools with higher percentages of these students were more likely to be identified as trauma informed, but now we're seeing they're also less likely to have a more positive climate. So we're identifying them as trauma informed, but they're not benefiting from improved climate. So the implication here is that trauma informed approaches may be reduce or reproducing structural inequities instead of addressing them unless we explicitly center equity and do not take colorblind approaches. So then we move into the third study, which is in-depth semi-structured interviews with a subset of the participants who filled out the survey. Studies one and two told us what differed between schools identified as trauma-informed and not. Study three goes more in depth and asks practitioners what they think should be in place and what outcomes they're actually observing. So the interviews were, I conducted 20 in-depth semi-structured interviews by Zoom. They were between 30 and 45 minutes. There's a diverse geographic representation, but of course, not everywhere is encompassed in these reports. We have social workers from Connecticut, Pennsylvania, Illinois, California, Texas, and Florida. But of course, there's many other states that I don't have social workers from. There's also a range of school contexts here. They were serving across the K through 12 spectrum and in different levels of urbanicity. All of the social workers here, and they self-selected, were incredibly experienced. 50% of them had more than 20 years of experience serving in schools. The remainder had between 3 and 19 years of experience, with about equal amounts between 3 to 5, 6 to 10, and 11 to 15. So the approach here was to ask them, what do you think is necessary in a trauma-informed school? What facilitates or hinders implementation? What kind of outcomes are you observing from having these approaches? And then I conducted a thematic analysis with deductive coding. And the reason why I did that was because I wanted to compare their responses to existing frameworks, both the one that I synthesized as well as other ones that are available out there. So the key themes that emerged or that I identified were that school social workers said a trauma-informed school must be a holistic systemic approach. It must permeate all aspects of the school. In order to create such environments, you need leadership that has trauma-informed approaches personally. So the leaders have to demonstrate empathy, self-awareness, humility, and a growth mindset in order to get other people engaged in being more trauma aware and trauma informed. And then I specifically asked social workers about their perception of trauma informed being connected to a DEI based on the prior findings of studies 1 and 2. 14 out of the 20 said that you can't do trauma informed work unless you're paying attention to ADEI. But the remaining 6 kind of defaulted back to that colorblind approach. Now, I have quotes in here that I will share as examples, but I just want to cover real quickly that there were several notable absences in what social workers said a trauma-informed school was. They did not emphasize the availability of clinical trauma treatments in the school, nor did they mention the secondary traumatic stress resources. And in fact, several of them were surprised when I said that that was a significant factor that was identified. And so what I'm finding from social worker perspectives is that their perceptions do not directly match some of the dominant frameworks that we have for trauma-informed schools, including those from the National Child Traumatic Stress Network. So here's some example of quotes regarding the various themes. For holistic systemic focus, someone said, I don't think that you can have one program where a kid goes and it's a trauma-informed school. You need to have the lens of trauma-informed seep throughout the school from administration all the way through to like lunch aides, school aides, security guards. With regard to interpersonal connections, someone said, in general, to be a trauma-informed leader, you need to provide empathetic listening to your staff, hearing their needs, providing that sense of safety, like emotional safety, and creating those brave spaces to have open, honest conversations, both in a group setting and individual as well. And then with regard to the dichotomy in theme 3, an individual who was pro the connection between TI and ADI said, you need to have a trauma-informed lens to really talk about equity, and you need to be looking at equity to really have a trauma-informed lens. And then someone who took more of a colorblind approach, when you look at what the actual goal is, it's to support the individual student. And so that's where their similarity lies. So then let's talk a little bit about the barriers and implementation gaps they identified. So in terms of organizational barriers, they mentioned the checkbox mentality in education. For example, we will get this money if we do this thing. So let's just do the thing and get the money. Shifting priorities and initiatives, one day we're talking about restorative circles. The next day we're talking about, trauma-informed approaches. The next day we're talking about enhanced security measures. So the focus is hard to keep present and moving in a certain direction. There's also limited resources and time, of course. I mean, these are schools, they have a lot of responsibilities for educating students. And so there isn't unlimited time to be thinking about other things that are not central to the education mission. And as a result of all these changing factors, people become resistant to change. They're like, yeah, I don't have time for that. I'm just going to ignore it. And the lack of accountability systems makes that possible. So implementation gaps to pay attention to. Training was identified as essential but insufficient to a trauma-informed approach. And as you saw back in the policies and practices study, 80% of trauma-informed schools have training and 33% of them of non-trauma informed schools have training. So training is existing, whether or not schools are identified as trauma informed. There's a need for systemic policy change and not just those training approaches. There are challenges to sustainability given the shifting lenses and focus that happens in education. There's inconsistent understanding across staff. For example, I heard that they would bring in training for educators a few days before school started, but then it would be all very theoretical. It wouldn't be practical and implementable right in the moment. And so then they don't have time to figure out what that would look like. And then there's a lack of formal metrics for tracking change. Social workers were reporting anecdotal positive outcomes, like, there was this kid who brought a toy gun to school, and normally that would be an expulsion or a suspension, but instead we realized what he was trying to accomplish and getting more attention from his classmates. And so we brought in the parents, we had a discussion about the dangers of even toy weapons, and we provided additional ways for him to engage with his peers that did not involve, suspending or expulsion. So that's a lovely positive outcome for that child, but is not looking at the broader picture. So to summarize the integrated findings across all three studies, study one, almost all of the policies were more prevalent in trauma-informed schools versus not, and training and STS resources were the strongest predictors. In study two, as you saw, there were clear climate differences. A commitment to training and trauma awareness was the strongest predictor, but also there are clear differences in safety, feelings of safety, positive relationships, and strengths-based and equitable approaches. And then in study three, the focus on holistic and systemic views as essential, leadership, being self-aware and empathic, and then making the specific connection between trauma-informed and anti-racism, diversity, equity, and inclusion. And so the implications from these is that it's time to move beyond training towards taking a systemic lens towards this work. Equity must explicitly be centered, or we're risking reproducing real harm. And the social worker role needs to be expanded to have more influence on organizational leadership. Traditionally in schools, social workers have remained very focused on interpersonal interventions. Sometimes they provide some classroom interventions, but they're not really influencing how the school is run overall. The latest practice guidance from the School Social Worker Association of America, however, says that social workers should be doing this kind of work. So the key is figuring out how to do that. So the bottom line is trauma-informed schools involve genuine culture and climate shifts, and equity must be explicitly integrated. Now, I want to address all of the study limitations. Of course, there's design limitations with this being a cross-sectional design. It was a self-report from a single respondent type, and the best practice in climate surveys is definitely to survey across the different respondent types. There's a binary trauma-informed identification question, which, if we had stronger ways of identifying trauma-informed versus not, I would certainly love to incorporate those. This was a convenient sample because we were just, trying to get some information about differences between trauma-informed and non-trauma-informed schools. And how I'm addressing these is planning for some longitudinal studies to better understand change processes over time and what facilitates the continuity of trauma-informed approaches. And then also, I'm already doing multi-stakeholder measurement in another iteration of this instrument in another context. So that is in a child welfare nonprofit across California. And then continued instrument validation. And then ideally, we would be looking at everyone's responses from a single school in order to understand climate and the perceptions of climate by individuals in that school based on role, based on race, ethnicity, based on socioeconomic status. So we can really separate who a climate is working for and who a climate is not working for. But the overall implications from this work are good. For research, we need to continue developing standardized assessment tools to better understand how trauma-informed approaches work in practice. We need to start looking at long-term outcomes and really tracking what comes out of these approaches because we still don't know. We need to make sure that equity is centered in all trauma-informed research, and we need to continue to include practitioner perspectives because oftentimes climate work is focused on students in schools. From a practice perspective, like I said, the social worker role needs to be expanded to have more administrative impact. We need to move beyond training as an approach in schools to a more systemic focus. We need to address racial trauma and intergenerational trauma more explicitly. And we need to build accountability systems to ensure that we're achieving the results we expect to achieve. From an education perspective, this is less relevant to y'all, but to social workers, social work educators, it's important for us to train social workers in organizational change and not just interpersonal practice, help them develop trauma-informed leadership skills like empathy and self-awareness so that they can apply those beyond just a clinical intervention. We need to make sure that we're always integrating equity frameworks in how we educate, and we need to teach them how to do systems level assessment. Now, another factor that was brought up by some of the social workers is that the way they got influence in the school was by speaking the language of the education and administrative systems. So instead of focusing on the importance of whole, youth development, they focused on, doing this thing helps kids stay focused in your classroom. And of course, that makes sense. So that's something that social workers need to do and adapt in how they approach working in a system that they don't completely control. In terms of policy, we need to ensure that equity is considered in all frameworks for trauma-informed approaches. We need to make sure that comprehensive approaches are funded and not just training. We need to continue to support practitioner well-being because everyone who works in a school is very stressed by all of the changing expectations and the demands placed on their time. And we need to create accountability mechanisms that schools and districts can use to monitor their progress in these ways. Now, we have reached the end. Yay. Questions are welcome. Please feel free to reach out. And if you have any questions about specific details, like I said before, I do have spreadsheets back here, but I will not share them unless you ask me to.